On Friday, Governor Charlie Baker told us he wasn't ready for anything like a shelter-in-place order and that he was waiting for the data. Today, it would appear that data may have come in, as he instructed all non-essential businesses to either go remote or shut down tomorrow. And there's now a stay-at-home advisory, which Baker was careful to note is not an order.
What this means is that everyone can still buy food at the grocery store, get what they need at the pharmacy, and of course, take a walk around the block or at the park. But if you're at the park, there shouldn't be any pickup basketball games, touch football games, or activities or events that create the person-to-person contact we are seeking to eliminate.
At least 9 coronavirus-related deaths are now confirmed in Massachusetts. And stay home as much as you can is the main message coming from the top as well, with the Surgeon General issuing this warning today.
I want America to understand this week it's going to get bad. Everyone needs to be taking the right steps right now, and that means stay at home.
But when it comes to the question of how long, that's a little less clear. Baker says his order will remain in effect at least through April 7th, but the president is already looking towards reassessing. Tweeting in all caps just before midnight last night, "We cannot let the cure be worse than the problem itself. At the end of the 15-day period, we will make a decision as to which way we want to go." That 15th day is next Monday. It's an indication his concern about the economy might soon eclipse his concern about the virus, and it's a prospect that's making many health experts nervous already. I'm joined via Skype by Dr. Joshua Barocas, an infectious disease specialist at BU School of Medicine and Boston Medical Center. He's also part of the hospital's COVID-19 response team. Doctor, good to meet you. Thanks for being with me. So clearly, the governor is getting tougher by the day. But the question, I guess, is for people like you, is he tough enough? Here he is in his own words this morning, speaking about this stay-at-home advisory.
I do not believe I can or should order U.S. citizens to be confined to their homes for days on end. It doesn't make sense from a public health point of view, and it's not realistic.
Is he right, Doctor?
Well, I think that the governor has taken a very, very important step, and it's very much in line with what we've been saying from the public health and the medical sectors, which is please, as much as you can, stay at home, wash your hands, don't interact outside of your small family unit. There's, as far as ordering versus advising, it's certainly a tricky line to toe. I think that both of them accomplish what we're trying to accomplish, which is helping the citizens of Massachusetts understand the gravity of the situation.
But are you have confidence that they'll honor it? Are we flattening that so-called curve, Doctor?
Well, it's hard truly to say exactly where we are on the curve right now. I hope that that the citizens of Massachusetts take this seriously now that it's coming from the highest level of government in the state, that this truly is the best and most effective way to, as you said, flatten that curve. And I think that as much as we can unify that message across all sectors, then that message will get out more and more.
Working at BMC, obviously, you work with a lot of low-income people. A doctor from Virginia Commonwealth was quoted in Tom Friedman's column in yesterday's New York Times saying this: income is one of the strongest predictions of health outcomes and how long we live. To paraphrase Donald Trump, is it possible that the cure is worse than the disease?
There are a lot of things to take into account, right? So we are doing everything that we can right now to prevent further transmission. And that means trying to set up places for low-income families or unsheltered individuals or even sheltered individuals to go to be quarantined and isolated. We're trying to set up across the state and across the city. We're trying to set up, I know that the government is trying to set up stopgap measures that they've put in place for the economic toll that this is taking. in the long term, we have to play this long term, this out a little bit over the long term, right? That if we don't do these measures right now, and then our hospitals are at risk, our healthcare infrastructure is at risk, and the long-term consequences are, I think, a lot more dire than short-term economic instability, because that longer-term instability in the healthcare sector and in the health of our citizens is actually going to lead to more economic instability. And so taking these aggressive measures right now, as the governor has done, and as governors across the country have done, are, I think, hopefully going to stave off a longer term economic instability.
We should just say in passing, you're involved in that tent treatment that everybody is talking about provided to homeless people in terms of treatment, quarantining, that sort of thing. You know, the WHO today said the spread of the virus is accelerating. Do you and your colleagues at BMC feel prepared for the onslaught that is likely coming?
Well, there are two ways to answer that question. If you're asking if I have every confidence in my colleagues and in myself and in health professionals across the country to be intellectually equipped to deal with this,
I know the answer to that one. The answer is yes to that one. It's the second one. How about the second one?
The second part of that is that I believe that many hospitals are trying to procure as much personal protective equipment as humanly possible, and I think that's the question of the day. Yeah, but if that supply chain dries up, then it's very possible that we won't be protected. Currently, I am not at a crisis mode where I don't think my hospital will protect me.
But you know, yesterday we heard the president, I use the term carefully, bragging about sending hundreds of thousands of masks out across the country. We heard a doctor on this show last week say that the need is probably somewhere in the 3.5 billion range, billion. And the federal government's talking about shipping out hundreds of thousands as quickly as possible. Don't you feel there's a real disconnect between the need and the understanding in Washington, or do you?
You know, I think that there might be a disconnect, especially since here on the ground we are treating patients, and we're coming up with protocols for PPE preservation, or personal protective equipment preservation, trying to make sure that this lasts as long as possible, because we don't know how long the epidemic is actually going to last. So the scale of where we're of what we're trying to accomplish may be off from that federal response, but I do have every hope and also every confidence in, certainly here in Massachusetts, that the hospitals are working together, that the cities and the state are working together to try to be honest, to fill that gap.
Doctor, I surely hope your optimism is well-founded. Thank you much for your service and for spending some time with me tonight. I appreciate it.
My pleasure. Thanks for having me.